So are we ready? Are we live? Okay, thank you, Lisa, for the input. So welcome, everyone. It is November 9th, and we here at Fresno County Department of Behavioral Health are going to be hosting this afternoon a virtual panel discussion with a couple of really great speakers who can provide some information on how we can support and better serve our veterans in the behavioral health field. While our target audience is not veterans, if there are veterans out there watching today, welcome and please stay on here. What we're trying to do is really provide some insight from people who work with veterans and have found some really effective ways of support our veterans, to share some of that information and insight with those of us who are not veterans, but who either work with or potentially could be working supporting veterans, so that we can make sure we do a better job with our behavioral health services and really address the needs of our veterans. So thank you guys, everyone, for joining us. We're gonna have our panel share a little bit about their work. We're gonna have them share, share a little bit about the work that they do. I'm sorry about the background. We're doing this live, so you have kids also doing their distant learning. So my apologies there. But what we're going to do is ask some questions that will really hopefully get some insight into the work they do and how we can do a better job. And then through our Facebook Live, we'll also be able to have people ask questions of the panelists, and we'll try to get those questions to them as well and see if they can answer those. So think of this as really more as a conversation today with our panelists. We've got some great people. They're going to cover some specific areas, but after that, we're going to have really an open discussion. So should be good. I'm going to go through the bios real quick of our three speakers today. The first one is Mario Lopez, LCSW. Mario is a former naval veteran, Vietnam era veteran. I had the pleasure to work with Mario for just under 10 years, I think it was, in Kings County. We worked together supporting veterans. Mario's an LCSW. He's been a therapist in private practice for over 36 years. He continues to do clinical consultation with Kings County Behavioral Health. He also supervises some clinical interns. So if you're looking to get some internship hours supervised, Mario might be a person for you to talk to. There's a plug right there for you, Mario.
Thank you.
He has extensive experience working with children, teens, couples, and now veterans. Mario has run a veteran support group for over 14 years. He has a couple of specialty areas as well, teen self-injury. So if you guys are interested in that, definitely we'll give his info. You can reach in that. I guess the way the common layperson term for teen self-injury is a lot of times is cutting. So if working with youth who do a lot of cutting. Mario has done work around PTSD, sexual abuse, ADHD, depression, anxiety disorders, a variety of different things. He's been a certified instructor for programs such as Why Try, Within Our Reach, Family Wellness, and one that's not included in your bio, Mario, is also Valor, another kind of Valor, which we'll come back to later on in this conversation. He's trained in CBT, DBT, and EMDR, and EMDR is also one we may have you talk a little bit about, because that's really some interesting approaches with EMDR, also with helping people with trauma. So we may have some questions for that, Mario. Darcy Evans, LCSW, is our second speaker today. Darcy is an LCSW at the Central California Veterans Administration Healthcare System. She has coordinated she's now coordinating the new Intimate Partner Violence Assistance Program, which includes training veterans and staff, developing this local program, which has been a challenge, I'm sure, trying to develop a new program remotely from home, but we'll have Darcy share a little bit about that. Darcy has worked at the VA for over 8 years. She previously worked in a role as military sexual trauma coordinator. She has over 30 years in the mental health field, including crisis intervention, HIV/AIDS, and inpatient psychiatric care facilities. And one of the things we're going to really have Marcy share and talk a little bit about is military sexual trauma. Just her experience with that, some things for us to be aware of that we may not think about, and maybe how to better support individuals in that area. And then our third speaker today bio is Stefan Wolfe. Is that how you pronounce it, Stefan?
Yep.
Wolfe. Okay. Who has a Master in Fine Arts, U.S. Army veteran. We actually learned about Stefan from and his work in his book called We've Been Patient Too Long. This is not a plug. I don't get any royalties on this book, but it is a fantastic book. For those of you in the field, my team actually asked us to read this book as part of our book club, and there was some really great stories in there from the work that people are doing to experiences people have had to, I guess the way they talk, well, the subheader is Voices from Radical Mental Health, but it's not radical. It's really common sense. I think it's radical if you compare to historically how we've done mental health, in this country. But back to his bio. So you can read a little bit more about his work in here too, in addition to what he's going to be sharing today. But Stefan has his Master of Fine Arts from Trinity Rep Conservatory in Providence, Rhode Island. On Broadway, Stefan has helped create military segments for the Twyla Tharp and Billy Joel's Tony Award-winning Moving Out. Stefan is the founder of Decruit, which is an area we're going to have him share a lot about today. And I don't say a lot, but we definitely want him to highlight and talk about the great work with that one. Providing a nonprofit that provides treating trauma through Shakespeare and science. Decruit received the 2020 Aaron Stein Award for American Group Psychotherapy Association, given to an organization that utilizes creative applications of group therapy to benefit the community, especially non-psychiatric setting, which is, when he talks about some of the stuff they're doing, it's going to be really, really awesome. I think you guys will find it really cool. We read it and we were like, we got to talk to this guy. Like this like, people need to hear about this. Also, Decruit received the 2019 Max Gabriel Award from NAMI. Stefan is a playwright and an actor, continues to perform in his award-winning critically acclaimed show, Cry Havoc, in the US and Europe. So welcome, Stefan. If I can turn it over to you and have you maybe start by telling us a little about Decruit and how you guys came about and the awesome work you guys are doing in terms of addressing trauma with veterans.
Right on. Yeah, thanks. And truly, thank you for having me, and especially with such a group. I'm a bit awed, so I'm honored to be here and a little awestruck. Yeah, the work, I want to be very clear, I'm not a licensed therapist, I'm an actor, but in the Army, to give the short version, or as best I can, it's what my show's about, is that I was in the Army. I've been in about 6 years. Just after the first Gulf War, I had a soldier commit suicide, and pretty close right after, a dear friend of mine was killed in training in California. It was in training, no less. I lost it, traveled, saw a Shakespeare play. It was Richard III. Didn't grow up in theater, never seen a Shakespeare play, knew nothing about it. How I wound up there, who knows? But which is another whole play or story. But it did affect me, deeply affected me to see Richard III, for anyone who doesn't know, is a military veteran who comes out, directly addresses the audience and says that that I'm really good at war. I don't fit in peacetime. The war is over, and now what? Where do I fit? And it resonated so deeply with me that it caused me to actually leave the Army and go to graduate school for acting. And in graduate school, I was finding that the actor training was actually helping me. I didn't even think I had problems. I swear to you, I was like, I'm fine. And the things that happened to me as a kid, I was a kid. And things that happened to me in the Army, they're past, get over it. And but the actor training was not only causing me to even inadvertently access thoughts, memories, and feelings that I thought I'd long put away, but it was giving me the mechanisms to cope, deal, and even recover with afterwards. And in fact, even deal with as it comes up again. And it was just theater. It was just acting. And then I was lucky enough to work with the Native American community, theater artists in Los Angeles there, and well, just south of you there, Native Voices, and in Canada, Native Earth. And I watched how they openly used theater as medicine. They stopped saying, well, it's therapeutic, but it's not therapy. They got in a circle, medicine circle. No one was higher than the other. We were all equal. And we communalized the trauma, as Jonathan Shea describes in his book, Achilles in Vietnam. Communalize the trauma, we support each other. And afterwards you not only feel better, but because it's theater, have a means to go on till we meet again, things to do. And I thought, why didn't we have this in the Army? We're recruited and we're trained so heavily to get into the military. And when we get out, there's no training to leave that war. And make no mistake, I'm not denigrating the military. They're brilliant at their job. They train us to kill. I don't care if you're a clerk typist. You learn to shoot at a human target first. Everyone's, has to be able to fight first and then do your job second. But when we get out, there's no undoing of that. And as I'm getting a little ahead of myself, but as hopefully our colleagues will talk about, what we're finding now is that those joining the military have higher ACE scores, higher adverse childhood experiences scores. So we're entering with the military with a host of, lack of a better term, issues. And then, so we're recruited but never decruited. That's where we came up with the name for the program and decided what we're going to do is borrow from everything that works, create a program that's steeped in Shakespeare and use that to help unwire from war and help unwire from the adverse childhood experiences. And the last thing I'll say about it, so you can ask me questions, is for anyone who's read James Gilligan's book, Violence, who also worked with for 11 years, ran psychiatric care in Massachusetts for the male prison system. And these were the most violent of the violent men. He worked with them using Shakespeare. He used Shakespeare, a community environment, and it was a 4.5-month program. The graduates of his program cut their recidivism rate, the return rate to prison, by over 90%. His graduates decreased the daily violence to being, instead of being double digits daily, it was measured annually in single digits. And this was a successful program. So I tracked him down and he helped me. He was very instrumental in first creating the early structures of Decrew. So in the interest and out of respect for my colleagues here, I will leave it to you to ask me more questions. Hopefully that gave you an idea of what
No, that was a great start, Stefan, because I think you talked a little bit about how you guys started it. You talked a little bit about some of the other things in there. I guess what I would like for you to maybe dive a little into is, can you give for listeners, viewers out there, a little more example when you talk about using Shakespeare for the go into a little bit more in terms of how you guys match that up, and specifically what are they doing with theater in order to, for lack of a better term, like exercise those demons, I guess, like how that works.
Yeah, and wrangle me in. But I'll talk about the Shakespeare and I'll work backwards. Because why Shakespeare? I'm asked this all the time. I'm finally writing about this more extensively for folks. But first of all, Shakespeare was surrounded by veterans and he saw veterans. He writes about our experience perfectly. If anyone is really interested, if you look at Lady Percy's speech to her husband in Henry IV, Part 1, she asks her husband a series of questions. Jonathan Shea, again, as I mentioned, in Achilles in Vietnam, takes her list of questions and next to it lists symptoms out of the DSM describing post-traumatic stress disorder. So it's a question from Shakespeare 400 years ago from a combat veteran's spouse asking her combat veteran husband, who just came home from combat and is about to deploy again, a list of questions. Why don't you sleep? Why don't you eat? Perfectly describes post-traumatic stress disorder 400 years ago in our language, but heightened poetry. So what I've done is taken 22 monologues symbolizing, it came out around that number, but I specifically did that to represent the 22 suicides a day. I've listed thoughts, feelings, symptoms if you need for this community, but I don't say symptoms from my fellow brothers and sisters in arms. We give prompted writings. From the prompted writings, I'll give them that list and say, write down all that apply to you. We're big into writing, not in terms of writing to develop it, but more like Jamie Pennebaker uses writing down significant events. So they write down their feelings and thoughts, then they pick one. And I've directly correlated, edited Shakespeare monologues for each one of these. So now they speak these out loud. So this language, Shakespeare provides the language that they may lack for their own experience. It also, as we know through Bessel van der Kolk's book, The Body Keeps the Score, if we're speaking this poetry, if we know how to breathe, and that's what the group is there for, is to help you breathe and stay grounded, you can keep the brain, the higher brain online. You can keep from retreating into the fight, flight, freeze, fawn, or other system. Broca's area requires that if we're reading, or rather the Shakespeare requires that we're keeping the language centers online. If we're looking around, making eye contact, we're keeping the medial prefrontal cortex, our sense of self, in the room, instead of retreating back to just the incident that we're remembering. And Shakespeare's verse, as Strozier writes in his article in 2005, he talks about how survivors of 9/11, when they spoke in blank verse about their experience. So Shakespeare is actually providing, dare I say, our trauma language. Breathe in, speak a line of verse, breathe in, speak the next line of verse. So the biggest reason for Shakespeare is providing a template of how to stay present in the body, how to stay in the room, how to speak about our experience, even though we might not have the language. And if we really need to use a character to create enough aesthetic distance, or to put it in our language, but in yours, I think it's safe, but not too safe. I can always say, well, that's, Richard III's lines, not mine. But so it provides a template with which to actually have the group therapy model and then support each other as we go around. So that's the basics of how we use it. Broad overview, but I'll leave it open to more questions rather than ramble on, because I could.
No, that was perfect. That's what I think would help people understand kind of the model, because it's like, well, what do you mean by Shakespeare? And I think that's a great example. And I have a list of other questions for you, Stefan, but I'm gonna go to Darcy and just to make sure we're all involved. And for Mario and Darcy, if you guys have questions for Stefan and vice versa, you guys will be able to ask each other questions too. So just think of this like, if we were not doing virtually, but we would be think of it if we were sitting around a round table and just having a discussion on how do we help veterans. And I want you to think of it like in that regard. So Darcy, I'm going to come to you next. And if you could maybe share a little bit about what military sexual trauma is, kind of who you've seen in your experience be affected by it, how it maybe affects some people. You don't have to write, you don't have to answer every one of those questions, but just kind of giving you the parameters. And then, why should those of us that might be providing services to veterans, want to be aware of that and understand that, because, and how it, by not being aware of it, not being able to approach it, how we might not be supporting the person and healing completely, if that makes sense. I'm sorry if I threw a bunch of questions at you.
No, it absolutely makes sense. The first thing I want to say to Stefan, I find that your work you've been doing fascinating, and I hadn't, to be completely honest, I hadn't heard about it really a lot until this meeting, and I definitely going to want to read the book now and kind of just get more information, because I can see just therapeutically too where there can be benefit. You're really helping people kind of, like you said, oftentimes we find is that, not just veterans, but people in general, especially when they've experienced trauma, they don't have the words to use it. They don't know how to identify those feelings and emotions, and therefore they can't use the words. So helping them without giving them words, without saying, here, this is what you feel, can be really, really supportive and really therapeutic. So I can think that's amazing, and give a chance to kind of get them really feel and not feel so isolated and so alone, but wow, look at other people have these feelings too. It's not just me. So I think that's amazing work you guys are doing, and I'm looking forward to learning more about it. Thank you. So I was asking, so in regards to military sexual trauma, how the DoD and the VA, how they actually define military sexual trauma is any type of, physical or sexual assault or harassment that's ongoing that has really been provided somebody to the point where they have having a psychological effects from it. As far as, when I say, harassment, it could just be they may not have actually been assaulted. They might have just been harassed, but happening on an ongoing basis, as well as, with the sexual assault. They may not have actually it may not have gone through completely. They may not have been raped, but if they were again assaulted or attempted assault, still, it's just as traumatizing as those who had actually completely gone through to a full assault. In regards to what we see, people don't realize is that it's actually much more common people realize, unfortunately. They don't, the last studies that I had saw, the ones that I was worked on the most was from about 2014 and 15. But at that point, what they saw was about 1 in 4 women and 1 in 7 men actually do experience some form of military sexual trauma. And it's if you think about just the full, extent of how many men there are in the military versus how many women, it really is much more common than people realize. And those studies that, and the amounts that they show, those are from people who actually come to the VA and who get their services from the VA, therefore they're screened. If you don't get your services and you don't get your care from the VA, then of course the numbers I think are actually quite a bit higher. Because a lot of people who are private sector aren't getting screened for it, aren't being talked about it. But when you come to the VA and you see a doctor, within the VA system, that's one of our things is we actually screen people once. Unfortunately, it's only once in a lifetime, but they will ask you if you've had any military sexual trauma, and that's really important to ask because, like a lot of traumas, people won't talk about them and right out. They're not going to come out and say, "Oh, this happened to me," but they want to talk about it. So if you ask them, they usually will talk about it, or they'll say, "Yes, this happened," "No," or "No, this didn't," or "Yeah, it happened, but I'm just not comfortable dealing with that yet." Okay, I can respect that. And then letting know that there is help here and that we're here. With the private sector, I think one thing that's really important for those who are, working with veterans is being able to understand the military culture. And I'm saying this as somebody who, I didn't really clearly understood it. And I don't know if I still don't understand it fully, but I have a much better understanding of it. Again, understanding everyone has their own experiences and based on their, as we know, based on, on their own experiences, like I said, then their ACEs and their traumas or any issues or problems they had even prior to the military, based on those experiences, it's going to, determine how they interpret what happens to them. And it really does change their views on themselves and the world. And in the military, they're taught, you talk about boot camp, for example, they really break you down to build you back up. So like, Stefan said, to be somebody who's going to be able to heal somebody, and to be these soldiers. And you're always hyper vigilant, you have to be aware, and they really break you down. So then when something horrible happens, it just reinforces your thoughts of, yeah, this is a bad place, the world's a bad place. And it really just kind of, it reinforces those beliefs that maybe you already had. In regards to military also, it's a lot of, we talk about sexual trauma, it actually, unfortunately, it is, what studies have shown is that those who experience military sexual trauma have a much higher likelihood of developing PTSD than any other trauma. And part of that is because, again, when we talk about sexual trauma, it's such a personal thing and it really affects the person to their core. And in the military, you have somebody who is, could be, somebody else in your same unit. It's supposed to be somebody, who's supposed to have your back, right? Almost like a family member. So it's very similar to like being, having a sexual trauma family member in regards to how it affects a person. Where you see a civilian sexual trauma, if someone gets, let's say, a date rape, I don't want to minimize it by any means, but the effects is you don't have that same core feel of betrayal and of trust that kind of was broken that you do with here somebody's supposed to, protect you or be there, watch your back and help protect you. And then also too, when you look at, unfortunately, I think the military is getting a lot better about this, but it really, unfortunately, there's a lot of that stigma too of if you report, you're telling someone else, you're ruining their career now. Therefore, that you're not having taken that person taking responsibility. Now you as a victim are now doing this to somebody else. And so again, that's kind of that adds up to the layers and layers that we have in regards to sexual trauma in the military that you don't have outside in the civilian culture. I think being able to understand that and why, that's one of the reasons why you really don't see people speak up. And I almost expect it now when I meet somebody new and they say, yeah, this happened, but I didn't talk about it. I didn't tell anyone when it happened. Okay, I'm not here judging. We just want to help them to kind of work through it and kind of, be able to improve their life now. And how has this affected their current life?
Sorry, had to unmute myself. Darcy, I don't want to make a presumption at all, or I hopefully no one will take the implication, but is this something that you have in your experience or statistics have seen that tends to be more, obviously it can impact anyone, male, female, gender non-binary, but do you tend to see it more so amongst our female veterans?
Like I said, I think because of the way the numbers are, female veterans, what I've found, and I know Mario's worked a lot with veterans and sexual trauma as well, but my experience, what I found is they tend to be more comfortable coming up and talking about it more. But as far as how often it happens, yes, it does happen. They have a more likelihood of happening. But again, there's so many men in the military. You look at the numbers, 1 in 7 men is experiencing it as well. That's a lot of men. So overall, there's probably more men than there are women, but I see more women coming up and actually talking about it and, you know, trying to get service and treatment. With a lot of the men, what I found, unfortunately, is that oftentimes they don't want to come and get treatment, they don't want to get services until it's really affected their life in such a negative way that they don't have other choice.
Awesome. Well, not awesome in that, but I mean, great in the answer,
Yeah.
not awesome. That I have to make sure, like, the context for it, because I think it's important, because a lot of times when we're maybe serving an individual who's female, who's a veteran, we may not be aware of things like military sexual trauma, so we don't know to ask, or we may inadvertently ask something without really, like you said, factoring in some of those other things too, as far as the military culture and their experience. And like you said, I think there's definitely a difference of and not to minimize it, but if it's something or somebody random that you know perpetrates this on you, versus, like you said, that's someone that's supposed to have your back, because I think it's not just the violence and the harm that came, but also the trust, you know, the core of everything that's built around, as you know, as Stefan was saying, you know, brothers in arms, and it's like, we're here for each other. You broke like, really, I would say the bonds within, you know, when you talk about combat, as a person who's never been in combat, so I do not want to take credit, but you hear from people, you know, the bonds that are forged, you know, in combat, you know, some of those strongest types of bonds, and then have that broken in such a way by someone that's supposed to have your back. I mean, is that trust factor, and that just making it worse?
Absolutely, and that's why I say it affects to the core more, so much more of a core of who you are, versus, you know, with the civilian trauma. That what we see it so much more, and even like with combat trauma, again, I don't want to minimize that, because that really is very distressing and can leave, you know, tremendous scars. But absolutely, but you know, it's something that you kind of start to blame yourself for, and you start to get, especially when you're being blamed for it as well by people who are around you. And think about this too, in the military, you know, if it happens again, let's say in the civilian world, and you're going out and you go date raped, you're not going to see that person again. Where with military sexual trauma, you're with these people day in, day out, and you can't just walk away and get away. You can't just get a new job and leave. That's the difficult part. So it's really, this is your life now. I've heard stories. I had a story of one woman who I spoke with, who, after she had reported her sexual trauma, her commanding officer, they had to go on a hike the next day, this very large hike, and her commanding officer wanted to make sure she felt safe. So she kept that perpetrator right in front of her the entire time as they did this hike. It was like a 20-mile hike. And she had to just see this person. So she was constantly being re-traumatized in situations like that.
That's why I think it was really important to make sure that, and I wanted you to be able to share some of that insight, you know, on this discussion with our veterans, because that's something that we forget about. I mean, there's a lot of things that happen, but I think as a person who, you know, volunteers, you know, to join the armed forces, and, you know, doing a noble cause, there's some things that you kind of, for lack of a better term, I guess I would say, like, you kind of know you're signing up for. Like, I know I'm signing up for it to be rough. I know, as Stefan was saying, you know, I'm being trained to kill. That's kind of one of the main. There's things that you know that you're aware of and you can accept, but I don't think anyone goes into it saying, like, you know what, I want this to happen to me. And so I think you made a really great point of how it can impact someone to their core.
And they absolutely shouldn't have to. And unfortunately, it happens, like I said, much more often than people do realize, and it happens much more often. And again, with that military, you know, the military culture, you know, part of it's, you're taught to be strong. You got to be strong, you know, be a soldier. You just power through stuff, and you know, you don't, you know, this is why, you know, we see so much with, you know, the substance abuse too. You know, you don't have a chance to stop and feel anything. You don't feel. You just deal, and you keep on going. And it's, you know, allow that time to process those emotions, and that's the hard part. And that's when we end up seeing so much more difficulties with our veterans and the civilian population in general.
That's why we got to get more groups like and services like Decruit to help people process through that. But I want to bring Mario into this conversation as well. And Mario, I want to touch on two parts. One, you know, some of the stuff that Darcy was talking about, you know, really the importance of understanding military culture. You were a trainer of another kind of valor and have even modified that to do a lot more. And I've gone through your training. I recommended it for a number of years. I still do. When we talk about, training, and we talk about terms like cultural responsive and cultural competency and cultural humility in behavioral care, we need to make sure that we're also thinking of subset populations, and one of those being veterans. I think a lot of times we think of like, well, do I have something that's cultural responsive for our Latino population? Everything from making sure services are available in that language and things that are culturally appropriate and recognizing those things. But sometimes, I don't say, I think people do a good job, but sometimes we forget the veteran subculture has its very own culture, has its own language, vernacular, experiences, things like that. And really the importance of understanding that so that we can better support people. So Mario, if you could maybe talk a little bit about what another kind of valor was, and how, and or just why it's important for people to understand military culture. And then I'll have you maybe touch a little bit also about the work you've done and how you've been successful and effective in engaging veterans in services through some of the support group work you've done.
Can you hear me okay? Can you hear me okay? Darcy, I remember working with this lady, veteran, and she had talked a little bit about MST. And one of the things that she said was, she was re-traumatized on a daily basis. Apparently, she had been raped by several of her, some of the members in her company. And unfortunately, they had taken pictures of her and they posted them everywhere. And so she says she was out there, trying to take the pictures down, and there wasn't a whole lot of support, and they just kept telling her, to be quiet and to hush up and, just deal with it and that sort of thing. So I don't know, any time that I hear about re-traumatizing, I think about this lady, re-traumatized she was. Not only that she was raped by several of the company members, but also, the pictures were taken and they were just floating around, whoever wanted to see them. So yeah, pretty devastating for her. Another type of valor. Yeah. So I've been working with veterans, and I was working with veterans on an individual basis for years and years and years. And so let me tell you a little bit about some of the things that came up for me in terms of another type of valor, okay? So the presenting problem, anytime we do a psychosocial assessment, we start off with identification, ages, religion, that sort of thing, ethnicity. And then we talk about the second phase is that of the presenting problem. So I was overwhelmed with the presenting problems that I was being presented with some of the veterans that I was evaluating them. And let me give you a couple of samples or examples of, some of these presenting problems. So they came in with depression, they came in with grieving, they came in with being isolated from others, they came in divorced, broken relationships, DUIs, lots of DUIs, medical issues, domestic violence, CPS issues, hypervigilance, survivor's guilt, alcohol and drug abuse, angry, adrenaline dependent. And I'll tell you more a little bit about that. Exposure to Agent Orange, suicidal thoughts, anxieties, triggers, financial issues, traumatic brain injury, PTSD, and MST, just to name a few. So lots and lots of presenting issues, and some of these folks, they have both men and women. They have, many of these presenting problems that they came through. So, so I thought about, okay, so we started a group, which we'll talk a little bit about, and then I also started the Valor training. Okay, and the Valor training, it's a whole day. It's about 6-7 hours. And it's for folks who are working with veterans or are wanting to work with veterans and want to understand the veteran culture. Okay, so there was, I have one of our latest agendas, the Ballard training agenda, which we would go ahead and hand out to all these folks. And you were very instrumental, Ahmad, over in Kings County in promoting the Ballard training. So I really, really thank you. Very supportive of all of us. So we would welcome the folks, and we usually had a pretty large group, about 20, 25, 30 folks there, from all kinds of disciplines and all kinds of different agencies. So we would welcome them, and then we would talk a little bit about the veterans' military experiences, and we talked a little bit about, actually a whole lot about the presenting problems and some of the problems that they came with. And we talked a little bit about tribute to fallen soldiers, as you remember that, Ahmad. And then I'm partial to Vietnam veterans, okay, because I'm a Vietnam veteran. I spent 2.5 years in Vietnam. I was drafted. Yeah, a couple of minutes ago, you said something about, oh, I volunteered. Oh, I really didn't volunteer. But so I had many choices not to go into the military, but I chose to go into the military and sign that blank check, as they say. So, I talk a whole lot about my Vietnam experiences and some of the services that Kings County Behavior continues to offer to the Vietnam veterans and also all the other veterans. And then we would have Darcy Evans come and talk a little bit about MST. So we would have lots of guest speakers. So Darcy, we were fortunate enough to have her as a guest speaker, and she talked to the folks about MST. And then Daniel, Orta, and Myra, staff over at Kings County Behavioral Health, they talked a little bit about Kings County Veterans Court, and we can talk a little bit about that even more. And we also discussed, why don't some veterans talk about their military experiences? Those are some of the questions that kept coming up. How come these guys and gals don't talk about their military experiences? So we delved into that. We talked about, why is it that they don't talk a whole lot about their military experiences? And then we would have Devondra Sanchez, who's an LMFT and a good friend of mine, and she talked about what's it like to be a military spouse. What's it like to have your husband or your wife gone, for 6 months, 7 months, 8, 9, even a year? So what happens to the kids? So we call that home front. What's it like to be a military spouse and the trials and tribulations involved with that. And then we would have Scott Howe on the Kings County Veterans Services. They talked a whole lot about their services here in Kings County. And then we would have a Vietnam veteran, Mark, and then also we would have a Iraq veteran, and they talked about their experiences, and really interesting. The Iraq veteran who spoke about his experiences, he had a slideshow, and he had pictures of an IED, and he had pictures of the tanks and the people there, and what's it look like? Because I was always interested. I said, "What's Iraq look like?" And he said, "Well, have you ever been up to Avenel? I'm on your way up to Avenel." He said, "That's kind of the way it looks like. It's kind of hilly and it's kind of deserty." But, these people grow things, and they're farmers, and they have groves, and, they grow all kinds of good stuff. So that was kind of interesting. And then we had Justin Bond, who is a Marine and very, very active and liaison and spokesperson for the veterans. So we had Justin Bond come in and talk about his services. And that pretty much wrapped it up. But it was about 7-hour long, pretty much all day. Type of training for folks who wanted to know about veterans and the military culture. And we talked a whole lot about it. Yeah.
I was going to say, you brought up some of the presenting issues that some of them were facing, but I want to make sure for the people out there that they understand that you're bringing it up from a therapist in terms of these are things that we can work to support a person in getting better, and so they can regain control of their lives. And I want to make sure that people understand when you bring these things up is in no way is your intent to disparage or to label the veterans who have had that experience, as opposed to, and I'm going to go out on a limb and say it here, when Dr. Phil made statements, like, oh, well, these veterans are damaged, and they're, just really things that are not at all helpful. We're live, and I don't think Brian can edit this. I'm not going to use what my real choice of words on his statements were. But I want to make sure people understood when you're talking about the presenting challenges that the veterans are facing. In no way is it meant to demean or to label them, but it's more of, these are things that when you're doing your clinical assessment, you're able to identify, and these are things that you and Darcy and a lot of other clinicians who work and support our veterans are trying to help them better understand and overcome those experiences. I just want to make sure people understand that when you're bringing this up, the context of your Valor training is to help people like me who are not veterans, who maybe don't have that understanding of veteran culture, like what can we do to be more effective. So I just want to make sure that people that were listening to did not take you as making like equate your statements with that of Dr. Phil, but yours is more of, as a clinical assessment, person I have in front of me, not Dr. Phil, who hasn't practiced in 30 something years. You've been practicing for 35 some odd years every day. As you're doing assessment, these are things that you see, and these are things that you're needing to identify so that you can assist people. So I just wanted to put that caveat in there. But if you can also dive into, you've run veteran support groups now for, well over a decade. And I know you've done some things that have been creative too. So I know we've got Stefan, who's very creative with the Shakespeare work. But you've done some stuff that has been creative as well, as to be able not only get those veterans to come and participate, but stay in there. So you address things that are what you would think of that people would address in a support group, but you brought in people doing demonstrations on like archery and all these other things too that are kind of like totally out of the box. So if you can talk about your work with the support group and some of those creative ideas that you've had and done to help really address their need and make this group about them.
Mm-hmm, mm-hmm. Okay, we did have the archery. We had the archery, and he was a veteran, and he had an accident, and he had no arms. Unfortunately, I think I lost your. I think you're muted.
No, you're good. You're good.
Okay, so it was pretty amazing to see, how he's compensated, and he's enters competitions, and he's won lots and lots of medals and trophies and that sort of thing. So, we did have a veteran who is an archery expert. So that was kind of fun, and we set the whole thing up, and he did the whole demonstration. But you have to be creative. Okay, and I've run now the group for about 14 years, and continuously I have maybe 20, 25 veterans that keep coming back in. Okay, so just let me tell you a little bit about what we do in the meetings. We meet twice a month for about an hour and a half. Okay, and you have to have food. Okay, so they like the food, and we also do raffles, and you were very instrumental in getting the funding for the raffles amount. So thank you again. And so you have to have the food, you have to have the raffles, and it seemed like the food, it was just kind of like a family atmosphere, just kind of relaxed everybody. And so it was kind of funny that that it just created this atmosphere, just friendship and camaraderie, and it was fun, and we had some really good meals. And the other thing too is that we would call them. It's really important to call them, and I'm saying we used to, because we haven't had our meetings now because of this COVID that we're facing for almost 9 months. And I'll tell you what we're doing with that. But so it's important to remind them a day ahead or the morning, because usually we had the meetings at about 5:30. So to remind them that today is the meeting, or tomorrow will be the meeting. So make sure that you're here at 5:30. So you have to remind them. And it's kind of interesting when we called them and we reminded them, they would say, well, what's the menu, Mario? Can we have spaghetti? Can we have this? Can we have that? So they wanted to place their orders, and we would respect, some of the vegan and some of the people that weren't able to eat some of the stuff that we were going to go and feed them. And so, and we would have guest speakers, or I would do presentations. And let me give you some of the ideas of some of the things that they really, really enjoyed. We talked a little bit about PTSD, okay? But don't burn them out on PTSD. Okay, everybody wants to talk about PTSD. They said enough is enough. We don't want to talk about PTSD, Mario. So we talked a little bit about PTSD. We talked a little bit about CBT, cognitive behavioral therapy, and how they can shift their thinking to release some stress and anxiety and fears. We talked a little bit about EMDR, and they love, did I say love? They love to talk about benefits. They love to talk about benefits and, how do they get compensated for some of these things that they're struggling with and they struggled. We talked a whole lot, which was a real popular one on forgiveness. That's really big now. And so we talked a whole lot about forgiveness because a lot of these folks, as aside from veterans too, they kind of carry some baggage. And so we talked a whole lot about that. I talked to him about chemistry, neuroscience, what's involved in the PTSD chemistry, what's involved in anxiety, what's involved in depression, what chemistry is going on in your brain. So we enlighten it with a lot of neuroscience, and then exercising, how important exercising is. And I encourage them to walk and to run and, just get up and do something. I gave a talk on phone apps. Okay. Predominantly, a lot of the veterans are Vietnam veterans. Okay. So we're kind of old school in a sense, as they say nowadays. So, and I pretty much keep up. So I said, hey, guys and gals, there's some phone apps that can help you if you're walking and you set this up, I'll tell you how many miles you walked and that sort of thing, how many steps and so that sort of thing. So they were really, really happy with that, and they started using it. We talked about Veterans Court rather than the courts taking a punitive approach, helping them out. Okay, have them attend therapy, have them attend drug and alcohol abuse, and whatever problems that they're facing. We had people come in and talk a little bit about finances, and we had post-traumatic growth. Everybody's heard of post-traumatic stress disorder, and I need to get some water. But so we talked about post-traumatic growth, and that was enlightening to them, and that, terrible things that happen to us and things that have traumatized us, we can turn that around and make it into a positive. Okay, we can learn from it, and it can make us even stronger. There's a song by, what's her name? Kelly something or other. What doesn't kill you makes you strong. Kelly Clarkson. Thank you, Darcy. Yeah, that in itself says it all. So you can overcome, and you can be victorious with all the traumatic things that have happened to you. And we also talked about moral injury, and the chaplain over at your neck of the woods, Darcy, gave us a talk about moral injury. And a lot of folks, a lot of veterans out there carry a lot of guilt over some of the things that they did and they've done. And, the Bible, if you're a Christian or a believer, tells you thou shalt not kill. And, we did. And
Mario, I thought you brought up a really good point, as far as moral injury, and I want to maybe focus to the rest of the panel too, as far as, well, you said, the 10 Commandments don't have an asterisk next to them.
Right.
They probably should, because I mean, it's like, hey, is this in context? Because when it says like thou shalt not kill, it does not put like an asterisk except in self-defense or except in service of your country. Like, it doesn't have these asterisks. And since you're a little kid, you're brought up, hey, thou shalt not kill, and then you, as Stefan said, is like, you have a job who your primary focus is know how to do that. You may do other things in your day-to-day job, but your primary mission is like, we need you to be able to kill if need be. And I'm oversimplifying, the military, and I'm not, and don't say that in a way that wants to be disparaging, but the 10 Commandments don't have an asterisk next to it.
They don't.
It doesn't say like, you're brought up like, don't do this, and then we're saying, hey, you know what? Go ahead, go ahead and do it to the other guy because he's a bad guy. It's fine. Like, and for the moment, you can make sense of it, to do because it's kill or be killed. That makes sense. But then, like you said, when you come back, that the moral injury of like, wait, but I did something that I feel is wrong, was raised and told is wrong, but they're telling me it's an asterisk in this situation. Just because it's an asterisk next to it doesn't make me feel necessarily better. So I wanted to ask all of you guys, Stefan and Darcy and Mario, like, have you guys heard or do you feel utilizing terms or terminology around more like moral injury is more helpful for veterans than maybe straight up PTSD, or like, are they more receptive? Do they relate more to the use of like moral injury to describe what they're going through versus PTSD? Like, is that something we should consider as service providers?
One thing that I do is I like when I'm working with a veteran, I tell them straight up, I'm not here to treat a diagnosis. I'm here to treat you. You're a person, and there are things that's going on with you, and that's what we're going to work on. So we don't even talk about diagnosis. We don't talk about PTSD. We don't talk about if it's depression, anxiety. Okay, how is this affecting your life, and what are the symptoms? What's going on with you that's affecting you, and that's really causing you distress. And that's what we work on and focus on, rather than try to take some of that stigma off and remove some of those labels.
Yeah, I 100% agree and love that, Darcy. Our group, keep in mind, again, I keep stating that it's not technically a group therapy model. It's a theater class. At its core, that's what it is. So when we get in, it's fairly obvious and hopefully given and stated that we're not there to pathologize anyone, diagnose, or any of that. But the terms, to answer your question, Ahmad, we do actually, similar to what Mario was saying, introduce moral injury, PTSD, and offer resources, because we recognize that for no one, there is no linear path towards healing or recovery, that it's whatever is your path. And so we're allowing resources and connectivity to these resources in order to, if something lands for you, we help connect you with that to get you headed that direction. But for our stuff, it's more about being able to observe ourselves without judgment, to observe what is the behavior. So if you check the box for insomnia, we don't have a box, but if someone goes, oh yeah, I also have insomnia, it's less about that means this, right? We're always trying to make meaning of it, but for our purposes, it's what are you feeling, where do you feel it in your body, and when else do you feel it? So we can give you the grounding and breathing techniques to recover from that, and perhaps even ultimately through practice, prevent. And then when we're really unpacking it, we add to, besides what do you feel, where do you feel it, and when is the earliest in your life you recall feeling that? Because the one thing I want to say is that for us, the thing that people tend to lock on, since you're saying, what do people want to, non-veterans working with veterans, I find that too often people walk with eggshells around it, and they also hyper-focus on it. When in reality, what we're finding in the room, the vast majority of this stuff can be traced back to early childhood survival mechanisms, coping mechanisms, whatever terminology you want to put on it. The way, we say this all the time to the veterans we're working with. When we're born, for the most part, if everything was born typically, to remove normative terminology, if you're born typically, you can breathe deeply and wail loudly for a really long time without losing your voice. And then if your childhood isn't too adverse, by the time you're a toddler and get developing language and understanding it, you're still able to raise your soft palate, soften your jaw, breathe deeply, and make these incredible sounds and fully experience emotions. But the depths of despair and ecstasy happen, and the recovery is very rapid. A lot of that gets pulled out of us. And the worse the childhood, I don't want to say worse, it's judgmental, the more adverse childhood experiences and or adult experiences and or military experiences, the more diminished all of that becomes. So what we're trying to do is just access that all once again, to realize that you can actually have emotions fully, deeply, and they don't have to hijack. They can, in fact, be felt, expressed, experienced, recovered from, moved on to the next one. And again, that's where the verse comes in, the Shakespeare verse, or an instrument, or singing. You can mess up a line if you're singing with the group and it's, hit the wrong note, wrong word. The hijacking can be dwelling on that versus when you're in the group, it's got to move on to got to breathe and move to the next thing. This correlates to the military experience. It's very rhythm oriented, very breath oriented, very camaraderie oriented. But I also wanted to hop on, I'll close with one thing to bounce all over the place. The other assumption is that camaraderie is universal for military veterans. It's not my experience, nor the experience of the thousands of veterans I've worked with. And in particular, with the women veterans, when we've worked with women veterans only rooms, they, generally speaking, that is what's brought up the most, is no one had their back as an individual. Very often not even other women. And that's regardless of whether they had military sexual trauma or not. Anything, the otherizing in the military is as rampant as anywhere else. It doesn't matter that we're on the same team. It matters when we're being fired at. You know, I can disagree with you, but then we got to cover each other. But when we're not under fire, it's not what generally speaking, not demonizing the military, but it's not what's in the commercials. It's not that way. It's vastly different. It can be, and I'll leave it there. But that assumption of camaraderie was something that even I was making, and it's not, turns out not to be true, that we can't assume that.
Yeah, and I mean, in the end, people are peoples, right? So, you know, some people are friendly and social, and some people are not really friendly and not, you know, that are self-serving. So just because you happen to, I guess just the uniform or the experience does not always equate to people, you know, bonding. All you know, some people just, that's just the way they are. But I think one of the things that Stefan, that you guys are finding, and maybe Darcy and Mario, is that that people sometimes are looking for someone that's had that common experience that can maybe understand. So maybe it's not the camaraderie, but like you said in your group, that I'm willing to be vulnerable in the circle of people to try this theater. I'm going to try this theater thing because at least I'm like, I know where you're coming from.
Yeah.
Right. Versus the general public, like, I don't know this guy. I don't know that guy. Sure don't know that guy. But saying like, I may not know you guys, but I know you've had at least some type of a similar experience. And then we dive into like, hey, we had similar aces. But right. at the minimum, it's like, oh, you were in the military how many years? Okay, I know you went to boot camp.
Yeah.
Like, I know you had to eat crappy food. Like, I know you ate MREs. Like, I know that. Like,
yeah. But the hop on, if I can hop on one thing on that, there is that. Make no mistake, there is a shorthand that if you served, there is something there. There is a connection, but it's I would argue that the opinion alert here, okay? But I would argue that it's a shame-based training as well. And that shame-based training continues. And it continues as veterans as well, because I continually hear this crap about, well, were you this branch or that branch? Did you have this job, that job? Do you have this experience? And look, the suicide rate is fairly indiscriminate. It doesn't matter if you're in combat. The suicide rate is just as high, we're finding, in peacetime veterans. Our addiction rate across the board is high, regardless of your experience. Our homelessness rate, and on, but much higher than civilians. So there's a commonality there. But we really pounce on the shame. Our goal is to create a shame-free room. And what that means, and take that as far as you want. For us, it's an ever-evolving thing. But what we don't allow is that I don't want to say allow, because that means like we'll shame someone for doing it. But what we're trying to do is allow people to reframe, that gentle ribbing, of, oh, you're in the chair force. I hate that. I hate it. I don't. It's just there's no play. This is not that container. When you're in our space, we don't do that to each other. We lift each other up. We support. It's, you were in the military, great. So was I. I don't care what your experience was, and it bleeds all over to whether you're late or late getting there or have to leave early. For us, we're like, look, man, I know firsthand what you're going through, how much it takes for you to get out the damn door. I know. Believe me, I know. So when you make it here, you're going to be received with affection. You're going to be received with love and a shame-free room to get in there. And very often, our room might be the only place for 90 minutes or 3 hours a week where they're going to get that space. And then if we carve that out for them, they're going to begin to carve it out for themselves. They're going to be able to carve out time and space for self-care, perhaps self-reflection, maybe even, self-care is a long ways. Let me reframe. For self. And then for those of us who are, really struggling on that self-compassion, maybe start opening the door, taking a peek at that and going, because how are habits formed? Repetition and reinforcement. So is that chain, repetition and reinforcement. So we want to find out what we did was distill down, what does trauma rob from us? What do high ACE scores rob from us? And let's create a room that actually brings the things that were robbed from us into the room and keeps the things out that want to hijack us out of that in a very broad sense.
No, awesome. So what I want to also allow for you guys to do, Mario, Darcy, and Stefan, is if you guys have questions for each other, like that you want to ask, like let's let you guys interact with each other a little bit, and I'm going to mute myself.
No problem.
Like I said, I find that, Stefan, just the work that you're doing really fascinating. And as you talk about it in my head, I'm kind of thinking, yeah, I can see, again, said therapeutically why this is such a benefit, because you're really giving these people a good chance to process that. And then, like you said, then once you have that safe place, you learn how to be safe and be gentle, have compassion for yourself in the safe place. You can start to do that, outside of there, again, in small increments, because it's hard for people to really to look at themselves. And I know, again, when they're in therapy, they're seeing somebody individually one-on-one, we're going to ask them to do stuff on their own outside of meeting with us. And a lot of times they may not be ready to do that yet. So that's kind of give them a chance to really stop and, do this work and look at themselves outside of that, even that one-on-one, therapy group sessions as well.
Yeah.
I should think, really fascinating.
Yeah. I had a thought and I lost it. I was listening like, oh, that reminds me of something. But it'll come back to me. Pardon me.
Stephen,
Mario,
I'm sorry.
No, go.
I was just going to say, Stephen, I was going to share that with you in terms of, shaming. I've experienced some of that in terms of, veterans will go ahead and start asking, what did you do? What was your MOS? What branch were you in? That sort of thing. And, I get teased sometimes because I was in the Navy. So, they'll say, well, the Gravy's in the Navy. And, those sort of comments. Those sometimes are not very beneficial. But, there is a flip side of that in that I think there is some camaraderie in veterans. And a lot of times, this is what I present in my Valor training, is that you don't have to be a veteran, to help veterans. It's totally unnecessary. And but there is a lot of times when, veterans come in some kind of presentation, invited them to become a speaker, and they'll say, I'm a veteran. There's sometimes some like instant trust. Okay, you're one of us, in a sense, versus you're not a veteran. But I keep pounding on them that people that there's a lot of amazing civilians out there that can help you out. So don't discount them. So and I always tell them, does oncologists have to have cancer to treat cancer? Absolutely not.
Mario, one of the things I remember you did with one of the individuals you were serving, and you had shared the story of you had said to the person that, hey, when they were in country and they were going on patrol or they were doing recon mission, be like, did you ever go out by yourself? And they were like, no. And it's like, oh, you had backup, you had people with you, right? Yeah. And you kind of use that thing of like, okay, well, that's what this is here. It's you're not going to get well all on your own, by yourself. You've got to have, a team that's going to help you, whether that's your therapist or it's your, faith, a spiritual advisor or your theater teacher, or, but kind of emphasizing that they didn't get to that point on themselves, and almost playing a little bit to their, I'm trying to playing to that experience of like, look, you don't do anything by yourself. You know, when you were in combat, for the individuals that were combat veterans, and you kind of utilize that approach of like, so if you didn't do that on your own, why are you trying to get well on your own? Why are you trying to get rid of your addiction on your own? Why are you trying to solve your, you know, and just really being able to sometimes I guess put a context for them in terms of, you know, the treatment side, and also I think you made the point of you know, you don't have to be a veteran to serve veterans, but how would you go about, you know, promoting or helping maybe veterans understand that you know, a person who's not a veteran can still be an ally in helping them in their you know, journey for wellness and recovery resilience. And that's for Mario, Darcy, or Stefan. Like any of you, like how could people, you know, demonstrate maybe or do things that can show that they're you know, an ally, I guess would be my question.
But I wanted to say a little bit of something about that. You can't do this on your own. Okay, I'm a huge student of Irvin Yalom. I'm sure you've heard of him, Irvin Yalom, and he did lots and lots of research. He's up in San Francisco, and he's done research on curative factors. What cures people in groups? Okay, it doesn't necessarily have to be veterans. It could be, you know, all kinds of different symptomatologies that they're working on. So one of the things that he does talk about is that you know, problem-solving skills, and within a group context, or universality. We've been there. We know, we've experienced, which, you know, of course, you know, veterans, but you know, MST folks who've been inflicted with MST. So there's that, and catharsis, just to be able to talk about these sort of things. So Irvin Yalom's a great resource if you want to find out what happens within a group context, what makes people well, what's curative for them in a group context. So I just wanted to throw that in, and I'm a big believer on that. And in fact, I did part of my thesis on Irvin Yalom. So it's good stuff, really good stuff. Curative factors.
Go ahead.
Oh, go ahead, Stefan. Go ahead.
I was going to hop on that, which I'm pointing like as we're the Brady Bunch. So, but Kent Harbour out of Rutgers, social psychologist, research psychologist, has a fairly famous Hill test. So, and what he did, it was non-veterans. And the Hill test is quite literally taking three different, if I recall it correctly, three different types of people, we'll say, to a hill to measure its steepness. People who were alone, people who were strangers, and people who were with friends or family. And the steepness is directly correlated. It's the same hill, but the perception of it directly correlates to how much camaraderie, if you will, to put it in our language tonight, you have with the other people. It can be less steep if you're there with people. He's found that if you're there with people that, you know, a lot of you are like, yeah, we can tackle that hill. And if you're alone,
support system.
Right?
Having more of a support system there with them.
Yeah. So there's absolutely, so when I was saying that earlier about the camaraderie, I just wanted to say that there's not the assumption and the way it that not everyone's the same. We very often find that there are folks that when we assume the camaraderie, there were some veterans who we could see retreat and almost dissociate because they're like, it's not my experience whatsoever. So that's why I wanted to throw that in. But you're right, it absolutely, the group model, absolutely for us, 100%. Look at the stats. I think our stats are one-on-one therapy, our dropout rate is 65% in the first 90 days. I mean, that's horrific. That tells us that something is a block there. There's some obstacle for us there in that regard. But Darcy, I apologize.
Oh, no, it's okay. I lost track already what I was going to say too. Clearly wasn't that important. But I definitely could agree with you as far as like, you know, with the group therapy in regards to the individual, you know, the dropout rate is much higher. Obviously, we see the studies show that, but, you know, my personal experiences is, you know, being able to kind of connect with the veterans too, is, you know, trying to help them maintain, is letting them know that I'm not here to try to fix them. I'm not here to tell them what to do, but to help them know they're doing the work. I'm just kind of here helping them with that process. But the reality is it's them. And I think that, you know, helping them understand that they are their subject expert is that they're it, not me. I'm here to kind of help them along with it because they know themselves better than anybody else.
Yeah. And I'm not to your point, Sorry, like I mentioned, this is like my 9th hour on Zoom. It's Veterans Week, so I apologize. What was your question again? Because I had an answer.
Oh, no, you're totally fine, Stefan. It's more. It was more along the lines of like, what are things that people could do to demonstrate and really become like that ally. For our veterans.
Yeah, again, I'm going to defer to Shakespeare because he says things so much better than I could ever imagine. There's a line in Lear that's, "Let us speak what we feel and not what we ought to say." And over and over again, when I've brought, for the past two and a half decades, whenever I've brought veterans into a certain group, not often, but we'll get that request once in a while of like, can you not use curse words, or can they not talk about this? And that's thematic. When we get with the veterans alone, or when I get with the that's thematic. We're very often asked to sterilize or turn down what we have to say, and in particular the way we want to say it. So that alone is one thing. Carve out, create a container where people can speak what they feel and not what they ought to say. That said, that's like I said, keeping in mind that there's no singular experience for the veteran to remove assumptions, to really just be, we have civilians who teach decruit. My wife is one of them. We have a gentleman in Fort Worth, where, by the way, whom has a vet court that's amazing if you want to talk about that, and a civilian in Chicago who's single-handedly launched our decruit program there, and they teach it because they come in with an empty cup. They're not trying to compare their PTSD to the veterans. They're not saying, I'm not a vet, but, right, that proverbial but that we tend to like just power down as soon as we hear it. I don't want to hear about your trauma. I like self-disclosure. We tend to like self-disclosure. That's the other thing that's different. So I know that in the therapy model, you're not really allowed to do so, but the big things, like I said, create a container where anything can be said. As much as you can get up off your butts or adjust to whomever's in the room, wheelchair bound or what have you, amputees, make sure the language is inclusive for all. Also to actually physically be in the body, get in, before pre-COVID, we would make appropriate contact, the shoulder, the back, that physical contact to bring us back in the room. Via Zoom, we just modified it. We're always creating different versions that, use the imagination to turn on that physical sensation. And breathe together. Above all, when we just soften the jaw and breathe together, and that's what Shakespeare does, is he creates a rhythm, natural human rhythm that we're already breathing. You can use a drum. You can just sit, because research has shown that we tend to entrain to each other's heartbeats and breath. You can sit for a little while. It's okay. You don't have to have all the answers. Ask questions, be prepared for whatever answer comes out, and let that inform the next question. That would be my overall advice.
That quote that you said, Stefan, the first thing I heard from that was being genuine and being sincere. Just being, and I think it's, which is so important, because not just veterans, but people in general, especially in a therapeutic environment, they're going to pick up on really quickly and really know. And then if you're not being sincere and genuine, but you're expecting them to be, that's not okay.
Right.
And again, and being present, but that's that quote that really popped in my head when you said that.
Thank you. Yeah.
If I can ask you guys a question, I know we're winding down here on time, but I know we talked a lot about things that we could do to support the veterans themselves. But do you guys have or just the work that you do in terms of supporting the families of veterans as well? So Stefan, does Decruit have a component that supports families? I know Mario has done some stuff with families, and I'm presuming you might as well, Rosie. But just if we can bring maybe that part into the discussion too here before we end, as far as what can be done, or what are you guys doing to support the families of the veterans as well?
I'll go quick if you don't, or I'll go first rather if you don't mind, because we do, but it's very small. We're also a very small operation. We're virtually 100% volunteer. It's not dissimilar to AA. When I got sober, the one thing I loved about AA, I needed CBT. It didn't work for me all the way because it was just white knuckling. But what it did was provide a template to go, oh, I love that I can go to any town, find a meeting. It's run virtually the same and it's free. So that's a lovely model that we are really trying to template, if you will, or copy. But we've been limited in being able to provide that for the family vet. So my wife created a program parallel with Decrude. So very often we try to whenever possible. I'll be in one room with the vets, she'll be in the other room with the family of the vets. And that way they both, they're in the same place, same concept, learning the same language, but maybe different rooms when we bring each other together and so on, as we're able to integrate it as well. But there's not enough. If we think that there's between 22 and 25 million living veterans, the census says that there are 3.14 family members per household. We're looking at 50 to 75 million family vets. There's no VA for the family vets. There's a record number of veteran service organizations, but not for family vets. So that is the thing I think we're lacking. I mean, we're lacking for the veterans too, but the family vets are suffering the most. And we know that, right, trauma isn't, again, linear nor in a silo. As Everett Cox says, if the veteran has PTSD, the family is feeling that or getting it as well. So all I would say is I hope you do, and I hope as I defer to Mario and Darcy, we do, but we're growing this program. We're starting from scratch. We're very small, and we're hoping to expand, but our plea is for others, as you develop programs, please keep them in mind and multiply the family services.
That's a good point, because I've read many times before is that, PTSD can be contagious. You can be vicariously traumatized yourself just by listening. So I've done lots of work with, in terms of, support for families and spouses, lots of work with family therapy, marital therapy, to help them understand what the veteran's going through, and some of, the PTSD and the stress and the triggers, and that sort of thing. I'll give you a quick example. I remember working with this couple, and which is very common. I've heard it many times before, is that the wife had asked the husband to go to a barbecue on Saturday, whatever Saturday that was, a Saturday. And he said, okay, so what are we gonna have? But it was at her mother's, or her parents' home. And he said, what are we gonna have? And they said, oh, they're thinking about barbecuing chicken. And he goes, I'm not going. She goes, why not? He goes, because I don't wanna go. And she said, you've got something against, against my parents. You have something against my family, that sort of thing. And kind of find out is that the fire pits in Iraq and Afghanistan, okay, and they used to put dogs and humans and everything. And he said to me, he was talking to me, and he said, the barbecue chicken reminds me of the fire pits. And he said, that's a big, huge trigger. And I said, so why don't you just explain that to your wife? That the barbecue chicken reminds you of, triggers some of your negative military experiences. He goes, oh, because she won't understand. And I go, well, give it a shot. Give it a shot. Talk to them. But so many of them are, they just don't talk a whole lot about, their experiences, because they might be a trigger, or they might assume that people just flat don't care. And able to connect, like you were asking, Ahmad, and able to connect with families, educate them as to what's going on with the veterans. Put some light as to why they don't want to go, to a family function when they're going to barbecue, different things. That's pretty significant. So,
Mario, we have a question here that I'm going to ask that's actually kind of directed towards you, but I think for everyone. But I remember actually in one of your Valor trainings, there was a gentleman who shared his experience as well. And for him, it was the smell of lamb.
Yes.
And he'd been involved in not just combat zones, but also like post tsunami and post earthquakes, and involved in a lot of I don't know what you would call it, but recovering persons. I like pulling people out of debris. I don't know what the proper term for it is.
Yeah.
For him, the smell of human flesh and decomposing flesh, for him equated to the smell of lamb. I have never had, I eat lamb, haven't had luckily the experience of having to do that, but for this person, that's how the sensory things worked in him. And it was like, he can go to a barbecue and you can throw hot dogs, sausages, burgers, he said anything's fine. Someone throws a lamb on there and it instantly was like a trigger for him that he could not, like he could smell, and it was just like, I can't, like, and so yeah, it's this abrupt, everything's going good, where's this guy taking off to? But it's that trigger, so understand that. But if I can real quick, we actually got one question that's come in. This is cool. I think there'd be more, but we were having a glitch with the Facebook, so it's live right now on YouTube. But on the Facebook, they were trying to update the glitch and work on that. I'm sure it'll be up there soon. But the question, I guess this would apply for all three of you guys, was if you guys could talk maybe a little bit about what you do as for self-care, just to avoid the re-traumatization, because you're working with people that have experienced a lot of trauma and it's new maybe for them in dealing with that. So whether it's Stefan's work, in the group, or Mario with yours, or Darcy, like, I think for some of our practitioners out there, their question is, what are some things that you guys do for self-care so that they could also be cognizant of and do that? Because if they're asking people, hey, open up, like Darcy says, so I can help you with, you're the expert on you, but I can support. How do we process so that we, don't experience that vicarious traumatization? As you guys said, that contagion, the PTSD, the contagiousness of PTSD.
I like to talk a little bit about that real quick. And that in the Ballard training, we talk a whole lot about that. We talk about what happens by listening to these things. And there's three things that could affect you by working with veterans and other folks. But you could be burned out, you can be vicariously traumatized, or you can become what they call compassion fatigued. So I emphasize to the Ballard participants in that you need to take care of yourself. You need to take time to for yourself. Go have fun and do fun things, and exercise, and talk about some of your experiences. Of course, respect to confidentiality, but talk to some of your peers, some of the people that you work with. Vent, get some discussions, some support from other folks that are not involved in this particular type of work. But it can get you. It can get you. So some of the things that I do, of course, I follow the Dodgers, and I absolutely go blue. They did very well this year. I belong to hiking groups. I'm a runner. I like to bike. I do marathons. Once I'm out of I kind of see my work clothes as my uniform. And once I come home, I take my uniform off and I put my shorts on, and, I have vegetable garden, and, I work on my truck and do a lot of camping and hang out with my family and my friends. So yeah, it's important to not work 24/7 and take good care of yourself and eat healthy and exercise and get lots of sleep. So I've been doing this for 38 years now, so I'm still at it. So obviously it works, and I still love my job. So yeah.
I just want to second what Mario said. I think all that stuff you said is so important. You're absolutely right. And self-care really is so important when you're working with people in general, especially when you deal with people who've had trauma. And I think everything that Mario was saying, I completely agree with as far as doing that. But I think what I'm hearing too is that it also helps you to have more of that self-awareness, so you can start to feel it. So it's important to have that self-awareness and maybe do some mindfulness and stuff, work on it within yourself too, so that you can have self-awareness and start to identify, okay, am I starting to get burnout? Am I starting to have some compassion fatigue? Because if you don't take care of yourself and you're not aware of what's going on with you, then you can't really address it. So you need to have that self-awareness also.
And I completely agree. And especially I was looking forward, my question earlier was, what do you do for that? Because you're licensed practitioners. For us, because we're in the arts, it's for one, to remember to practice what we preach. So my wife and I continue to do plays, Shakespeare plays. We're rehearsing 3 of them right now. Of course, workaholics, they're from a trauma perspective and through a veteran's lens, but at least we're still, every day it forces us, because we're doing plays, it forces us to do a vocal warm-up, a little bit of yoga warm-up. So we create things. And what I would say is, so if you're wondering, starting from scratch, what we tell with our veterans is to create a ritual and make that a routine. Ritual, I'm borrowing more from, I'll say, my brain's going in multiple directions. A ritual, simply to use Twyla Tharp's language, is something you create that makes it special. A little routine that makes it special, because if it's special, it's memorable and therefore repeatable. Churches do this, you go into a martial arts studio, they do it. So whatever is your ritual to before you carve out time for yourself, and then you repeat that. And it must be done. It might be, the ritual might be scheduling in off time. It might be as simple as that, as let me take, where are my breaks tomorrow? And the breaks have to be the opposite of what I'm already doing. And ideally an equal and opposite amount of time. And if they're not, then they're at least free. Very often we like to encourage people to go outside their comfort zones in that. So for example, I meant to say this to Mario and Darcy. You can't, it's too dark, but I just started learning the Ballard, a drum, the Celtic drum. And because it's completely like, it's a mind melt of how does this, it was such a neurological firing for me that it overwhelmed me and then calmed me down, I found. Then eventually, as I'm getting a little bit better, I thrive on that, or trying to learn a new beat or a new version of it. But and then I found that just that rhythm, I had to breathe, I had to ground. It wasn't there, and it put me just the resonance of the drum on my body. For me, I find that as little as 10 or 20 minutes on that just sets me right. I mean, I have a worse day, and there are many lately in 2020, but that, slap that on my thigh, play that for a little bit, and I feel better. Singing, whatever it takes. Shakespeare's term was lamentations. It was truly releasing it. And the last part I'll say to this is, I only studied it intellectually with classical actor training, but I experienced it with the Native American Theater Company. There was a shout out to Yvette Nolan in Canada, to the Native American Theater Company. We're working on a play by Marie Clements called Tombs of the Vanishing Indians. We got dramaturgy that was about that deep, and it was specifically to this play, and it was just a selection of atrocities that the U.S. has perpetuated on the very people's family whom I'm in the room with. 8 hours of working on this. By the end, I mean, my norm was a bottle of tequila a night. I'm not kidding. It was like I needed 2 or 3 just to grab 2 hours of sleep. But what Yvette started doing was drumming and singing. And we were singing in a native language. I didn't know what the hell we were singing, but it was fun. Because it was so foreign, it was like, there were word sounds that I liked and gestures that we did. And after 8 hours of pure trauma, 10 to 20 minutes of just dancing and singing in a language I didn't even understand, didn't know what we were doing or saying, I felt better. So when in doubt, just sing and dance. Do it badly. Do it brilliantly badly.
Love that.
Badly, freeing.
Stephen, I'd like to add something to that. Also include just comedy, laughter. You know, what the old saying is, laughter is good medicine. So, you know, I talked to them about, you know, just watch stand-up comedians and, you know, funny movies and that sort of thing. Just get out of the seriousness of life. And I realize that it's very serious, but especially nowadays. But yeah, and then also I like to add something too in terms of you know, I hope we answered the question, Ahmad. But one of the things that I use is that I always give the veterans homework. Homework assignments. Okay, and I say, you know, we can only do if we count out the hours, how often we meet every month, you know, be lucky if we meet maybe for 4 hours, and the rest of the time you guys are pretty much, and gals, are pretty much on your own. So, you know, I like for you to, you know, do some homework, and we'll come back, and it could be something very simple like watching a YouTube. And one of the books that I've used for many, many years, and I can share this, is that this one here, Stress After War. And it covers lots and lots and lots of different things, managing stress, and their workbooks. So they get to fill in some of the things. We don't do that in our support group, but I'll give them to them as homework assignments, and I won't forget. So when they come back, the following meeting, I said, hey, how many of you, gals and guys have done your homework? And they go, oh, we forgot. Well, make sure, because this is really important, and it's something that they can use. And whenever they're struggling with things, they can look at the chapters on managing stress, improving sleep, dealing with anger, reintegrating with family and friends, staying strong, stress management handouts, all kinds of things that they can look up. And so when they start asking questions about, well, Mario, I'm having some problems with insomnia, or, doing this and doing that. And I say, well, you remember chapter 6 on stress after war? Take a look at that, okay, and see. So this is a good tool. And the other thing that we know, as we all know, is that people learn in different types of ways. People can learn auditorily. People can learn visually or kinesthetically. So this gives them pretty much all those ways that we learn. So they do it on their own, and so it's become very helpful to me. And I always when they have questions about stress, and I said, well, take a peek at chapter 4. It talks about stress reduction exercises, and then we'll do a presentation of that as well. But yeah, so it's a good reference tool for them and for us as practitioners and helpers.
So I want to be cognizant of time, because I know Stefan is on like hour 10 now from when he started his Veterans Day week, and so I do want to make sure that he does get rest. But before we wrap up, I just wanted to remind people again, this book, I'm getting no royalties on this book. Just a colleague of mine was involved with developing this, and that's how we came again across Decruit and the work that Stefan is doing, and it's just awesome stuff. And go and check out the book, because not only is the work that you can see all the tabs I have in here. I really like the book, so you guys can see there was stuff that really stood out to me. I think it's good just for anyone that's involved in the mental health field, because it talks about just even some negative experience that people have had, and things that we can maybe learn to do better. But I think I said at the beginning, it's radical if you're talking about the way we've done things historically. But for me and a lot of my team, when we read it, it was less radical. It's more like this is more common sense. Why are we not doing it this way? So this is just my opinion. You may read it and get a different one. So that was one of the things. And the reason I want to highlight this book again is because it was the way that we learned about Stefan's work, which I think is just fantastic. A real other book, not a clinical, it's a fun read. I don't know if anyone's seen this book, Tribe, by Sebastian Younger. I'm getting a nod from veteran right there saying it's good. I read this I just wanted to get some better familiarity, and not from a clinical standpoint, but really gave some of those things we talked about some of those similar experiences and how we can utilize these things. So if you're interested in working with veterans, this might be a good place to just kind of a fun read. Again, I get no royalties from Sebastian Younger on this. It's in my library at work. I read this when Mario and I were working together a couple of years ago, and I kind of had an epiphany, there's an idea, some things that we could maybe start incorporating. But I wanted to give, before we close out, if you guys can just ways that people can maybe get in touch with each of you, whether it's through your program, like for Darcy, is it, do they just look up your program and service at the VA? For Sebastian, if you have a website, Mario, if it's on the county website where they can get info. So if we can just go around and you guys are in different orders on my screen that I'm showing you guys. So if each of you can maybe just share for the people out there that may be watching this later, even, how they can get more information on some of the work each of you are doing. And Sebastian, Stefan, can you start us off?
Sure, absolutely. I'll give you our website, www.decruit.org, spelled like recruit, DECRUIT.
No space. There's not a hyphen or on the website.
.org, not .com. And you can email me through that as well. The only reason is, if I give it out because we are on Facebook and other platforms.
Yes. No.
I get inundated with trash, and what I want is people.
No.
Or that want to reach out, human beings instead of bots. So
for sure, no. I totally agree and understand. That's why I was like, that's why I didn't say like your email phone number, but like a way that they could contact you. So yeah, through the website, definitely.
Yeah. Yes, definitely. You can reach me through that. Yes. Thank you for asking.
Not a problem. Darcy, if they have with your new program that you're working on, or even the sexual trauma. Well,
sexual trauma.
I'm trying to remember
sexual trauma. Yeah, so they could actually. Like, what's the acronym? They can actually call you. They can contact the VA, and you can actually ask me directly. My extension is 6308. They're at the VA. And also too, what I can do is if they have questions or concerns, or if they experience military sexual trauma themselves, I can help get them linked up with the correct person, as well as anyone who's had any kind of having any issues with intimate partner violence, and that's with families, veterans, and with our staff who provide that service for.
Okay, and I can be reached through Kings County Behavioral Health, of course, here in Kings County. So yeah.
And the website for them is still kcbh.org, I think it was.
I have no idea.
just if you happen, folks, if you happen to be watching this from someplace outside California and you're trying to find Kings County where Mario works, please put Kings County, California, because there's a Kings County, Washington, and then there's King County, New York. So there may be more. Those are at least 3 states I know that have a Kings County. So if you don't put sometimes specifically California, you could end up with all kinds like, wow, these are great services. Look at all the stuff they have. Like,
little did you know.
Like that's in the state of Washington. If you can get up there, I'm sure you could access all of those, but I don't know if you're going to get them here.
Also, Ahmad, if I could take a minute, I was just going to talking about books. There's a book here, and it's Soldados, Chicanos, and Vietnam. Okay, so specifically it has to do with the Hispanics in Vietnam, and it was written by Charlie Trujillo, and he's from Bakersfield. So he talks a whole lot about Hanford and Lemoore and just back here in my neck of the woods. So he talks a whole lot about his experiences and fellow Hispanics in Vietnam and their experiences from a cultural perspective. So,
very cool.
Chicanos. Okay, so I thought
Thank you, Mario.
No, you're welcome.
No. Good plug. I know Dr. White from our team is listening, so she's hearing this one. Is like, hey, book for the library. We have a equity library that we've developed here at Fresno County Department of Behavioral Health, and it's and we're working with the library, but we purchase books for our own to try to help improve our own health equity and looking at things from justice involvement of veterans to just really understanding implicit bias and things within systemic racism, so that we can do something about it. And so that'd be an interesting book to add to our library. So I'm sure she'll start looking it up and get that. But I wanted to thank each of you, first of all, for your time coming on here, giving us some of your time, especially Stefan, based on the fact that you were already online and doing this for 9 hours prior to and coming on here. Darcy, thank you so much for your time. Mario, always great to connect with you guys. Thank you guys for your service. Thank you guys for the work you do every day. Thank you guys for just really being creative and finding ways that we can better serve our community and really promote wellness. I appreciate your time. I will try to reach out to you guys afterwards separately, just an email for if there's any follow-up questions or if anyone has some info. But again, thank you guys so much. I think this is really a rich discussion. Hopefully it'll provide some of us with some additional insights. And Stefan, hopefully, like you said, the decrude model becomes something like an AA model, to where you can go into every town and there's at least one, and you can get the help you need there. And please, when you develop that workbook, email me. Let us know, and we would love to be able to help you promote and get the word out on that too. Okay.
I will. Yeah. And that'll help me finish it. Finish it.
Finish it. They're asking for it.
Yeah. Exactly.
And likewise, Ahmad, thank you for your support. Yeah. Thank you for for setting this up, and thank you for. I know I've worked with you for 10 years, and you've always had our back. So I really, really appreciate that. So thank you so much.
Definitely. Thank you guys again.
Thank you for having me too. Thank you for everything you guys are doing and the amazing work and the opportunity to hear about Stefan's work too, and to see Mario.
Thank you.
Yeah, I appreciate everything, Ahmad. Thank you.
No problem. Thank you all, guys. Have a good night.
Thank you.
Bye.
Bye-bye, guys. Thank you. Bye, Derek. Bye-bye.